Today, I'm going to discuss with you the aging of your eyelids. And many of you may be looking in the mirror thinking, I look tired and fatigued, and yet you have a lot of energy. It may be because your eyelids are actually aging faster than the remainder of your face. So we're going to explore together the reasons why we age, as well as the treatment options, both non-invasive and surgical treatment options to rejuvenate your eyelids. The eyelids are the epicenter of aging of the face. We're drawn to someone's appearance in terms of fatigue and being tired because socially and emotionally and professionally we're drawn to their eyes. But actually, there are subtle changes that are occurring not only on the eyelid as we age, but around the eyelid that impact the appearance of the eyelids. So for instance, the brow may be descending, or the brow may be deflated, so to speak. There may be hollowing of the temples or hollowing of the cheeks. All these surrounding structures contribute to the ultimate cumulative effect of aging of the eyelid itself. So I'm going to break down for you the 4 reasons why we have perception about eyelid aging. It is very important to get the diagnosis right, okay? Because if you don't get the diagnosis right, you can't proceed with correcting the problem. So the first thing I look at is, does the patient have any fat herniation? Okay, fat herniation is due to bulges of fat that come forward. Now this fat is actually not increasing in size. The fat isn't growing like it is on your hips or on your abdomen. This fat is static in terms of the amount of fat. The fat is actually coming from behind the eye. The eye naturally sits in a bed of fat and is suspended by these little fibers that suspend the fat upward. And as we age, those fibers get weak and the fat kind of sags down. And where does it go? By gravity, it goes down. It protrudes out, particularly the lower eyelid. Occasionally in the upper medial eyelid itself, there's a bulge of fat, but it's primarily the lower eyelid. So that bulging fat is number 1. The number 2 thing is there could be volume loss. So volume loss is due to actually fat atrophy. And the fat atrophy doesn't only happen in the eye socket in some patients where there's actually a darkening effect on the lower lid, but there's actually deflation of the eyebrows and sometimes the cheeks, which have direct impact on the cosmetic aesthetic image of the eyelid itself. So fat atrophy is definitely a big contributor to volume loss around the orbit. The third reason is skin laxity. Okay, and skin laxity is generally due to a loss of collagen and elastin around the eyelid skin, and that happens with age and accelerates in some people faster than others. And then also the sun may damage the skin, or heavy smoking can age the face more quickly. There are various environmental factors that can age the skin and create more skin laxity. And the fourth thing is called the eyelid cheek junction. And what is that? That is a demarcation between the eyelid and the cheek itself. And in youth, we have a continuum from the lower eyelid to the cheek. There's no demarcation between the eyelid and the cheek in general, in most people. But as we age, the cheek starts to descend downward. There's a laxity of the underlying ligaments and skin, and it is very important to restore that eyelid cheek junction to give a more youthful contour to the lower eyelid. It is critically important that I treat all the components of aging of the eyelid itself and around the eyelid in a comprehensive way in order to arrive at a very optimal result. If you take everything in a piecemeal fashion and you leave out some of the factors that are contributing to the aged eyelid, you don't get a great result. Now, the choice of treatment depends upon how advanced the age effects are on the eyelid already. So there are non-invasive options, particularly in younger people who are not surgical candidates at the juncture of their lives. Either their aging hasn't advanced, or there's a significant bulging of fat or laxity of skin. However, they may have some hollowing of the lower eyelid, and particularly in the inner corner, which can be improved with a deep injection of Restylane, which does not attract a lot of water to that molecule and can fill in the tear trough, which is in the inner corner, and give you a more refreshed, rejuvenated look on your lower eyelid. However, if you have significant laxity of the lower eyelid or wrinkling of the lower eyelid, you can use a combination of Botox, which can inhibit the muscle contraction around your eyes, inhibit the crow's feet on the corners of your eyes, because if you paralyze those muscles a little bit, You can inhibit some of the contraction, which is transmitted to the skin and leads to lines and wrinkles. And if those lines are stationary when you don't smile or frown, you might need to have some laser resurfacing, either using a laser or you can use a chemical peel, which gentle peel can peel off the top layers of the skin, and you get a resurfacing of the skin and rejuvenation of the skin. I don't recommend anything too aggressive like a Morpheus microneedling device or a coring device. Those are too aggressive around the eyelid. The eyelid skin is very thin and we don't want to end up with contractions and scars and other unfavorable outcomes. As aging progresses, commonly people will have some laxity of their upper eyelid, and in those cases I recommend an upper eyelid blepharoplasty, which is primarily to remove upper eyelid redundant skin, okay? And I don't typically take out a lot of underlying muscle with the overlying lax skin. Now, there are some exceptions. There are some patients who do have very thick orbicularis muscles, which are underneath the skin, and they need to be also contoured and trimmed down at the time of removing the upper eyelid skin. But in general, I take out primarily skin on the upper eyelid, and usually there's a little bulge of fat in the inner corners of the upper eyelids that also needs to be contoured as well, so you don't end up with a bulge of fat protruding out following the procedure. I make a very big point of measuring and the upper eyelid very precisely on both sides prior to making any incisions during the surgeries in order to get good symmetric results on both right and left sides. And I like to make low eyelid creases, not high creases, because I find that people who have high creases, their eyelids can look doll-like at the end, and I don't like that appearance. And all too often I see people who have too high a crease created following upper lid blepharoplasty. So it's very important that I try to recreate the natural creases that exist prior to the surgery. As far as the lower eyelid is concerned, that requires generally a transconjunctival approach, which is through the inner aspect of the lower eyelid, make an incision through the conjunctiva. The fat pads are generally considered to be the inner corner, the central and the lateral fat pads. Those three fat pads are reduced modestly, not in an extreme way. I don't create any hollowing effect in the lower lid. And then if there's any volume loss following that fat removal, then I obtain the fat from the belly, the hip, or the inner thigh, and I process that fat and re-inject it in the face as a fat graft. And I believe that fat grafting helps to restore the volume loss, and not only the lower eyelid, but it creates that eyelid cheek junction. It raises that eyelid cheek junction again back to a more youthful contour, and I think it's very important to restore that in order to regain a more youthful appearance to the lower lid. In addition, patients who have hollowing of the temples, they also need fat grafting at the same time the lower lid is restored, because that hollowing can also contribute to an aged appearance to their eyelids as well. And their upper brow may also be deflated due to fat loss and volume loss, as I discussed, and that can be restored again with some fat injected underneath the lateral portion of the brow in particular, and occasionally in the inner corner of the upper eyelid is also injected to restore hollowing of the upper medial eyelid. In addition, some patients need brow lifting, so they have a descent of the brow, and the brow descent can start laterally over here on the temples, because this is a gliding plane and allows the temple to slide down with age, and we need to restore that contour upward so there isn't lateral hooding, and that requires a brow lift, either endoscopically. I now perform gliding brow lifts in order to restore the brow in an upward, more natural position. So common errors or mistakes or complications do occur on occasion, and the ones that I see in my practice are when other surgeons remove too much upper eyelid skin. They create a hollowing of the upper eyelid, and that can be avoided by just preserving the underlying muscle without sculpting out too much eyelid fat, and then just removing a strip of skin without being overzealous in terms of the amount of skin removed, so that the eyelid closes and does not create any corneal exposure. On the lower eyelid, again, the biggest mistake that I have seen is that when people remove too much fat of the lower lid, creating hollowing, darkening of the lower lid, and without replacing the fat that's been removed with a fat grafting or fat transposition, there is a hollowing which looks abnormal, unnatural, and undesirable. In terms of removing lower eyelid skin, some surgeons think they can remove a big swath of skin of the lower eyelid. Unfortunately, commonly when they take out too much skin of the lower eyelid, there's eyelid retraction, or actually ectropions, which is like where the eyelid flips over itself. And sometimes they don't appreciate the laxity of the lower lid, which the lower lid sometimes has to be tightened in the corners in order for the eyelid not to pull down postoperatively during the healing phase of the procedure. In terms of lasering the lower eyelid, again, it has to be done in a conservative manner. Otherwise, they can get contractions and scars and pull down the lower lid, which requires further treatments, either with 5FU, which is an injectable, or even skin grafting sometimes is necessary to restore the contours of the lower lid. In terms of the eyelid-cheek junction, again, if this is not treated, there is going to be a demarcation between the lower lid and the cheek, and you're not restoring the natural, youthful contours that we see where there is very little demarcation between the eyelid and the cheek, and there is loss of continuum from the lower eyelid to the cheek, and therefore it creates a hill, a valley, and a hill, and that again does not speak for a more youthful contour. In addition, some people fail to treat the temples, and if you don't fat graft the temples or sometimes the brow, it can look deflated and it can have an impact on the cosmetic outcome of the eyelid itself. So all these factors need to be taken into account in order to arrive at the optimal result following an eyelid procedure. So the takeaway of my discussion is that the aging of the eyelid is multifactorial. There isn't one thing that's causing the eyes to age. There are many factors that are impacting the appearance of the eyelids as we age. And it is very important to take a comprehensive approach to not only diagnosing the problem, but also how to approach the treatment of the problems. And they have to be taken apart individually and then thoughtfully put together as one comprehensive package. It is best to avoid overheating, overcutting, and over-excising tissue, because in the end, you get less than an ideal result. I hope this discussion of the diagnosis and treatment of the aging eyelid has been helpful, and if you have any further questions, please leave them below, and I look forward to seeing you in my next video.